And well, it's Thursday, which means it's time. We always talk to one of the members of the medical community. This morning we have Dr. Thomas Clancy with us from New Hanover Regional Medical Center talking about trauma this morning. And I know one of the last time you were here, we spoke about traumas as well, I believe. And it really, I don't want to say it targets a population, but a lot of your traumas come with elderly and falls.
Yes. Bob, this is National Trauma Awareness Month, a date that was confirmed by several doctors and the Society of Trauma Nurses back in 1967 through the American Trauma Society, and Ronald Reagan made it a national awareness month for trauma. And this year the focus is going to be on falls in the elderly. Falls in the elderly result in over 2 million hospital visits a year and upwards of 21,000 deaths. So the emphasis this year is going to be on steps for seniors, but the organization has focused on many things: school violence, concussions, home safety, and a whole variety of public health issues related to trauma. In this community, we're working on the things that we see. Falls and gunshot wounds have become in the forefront of the news lately. And
how often when you say trauma, do they turn deadly? Because it's, I mean, you mentioned gunshots and things. I mean, we're seeing more and more now. You hear trauma, it's almost associated with death now.
Well, most of the time what we see is not fatal, but certainly the fact that that part of the trauma population involves young people, it is the #1 killer in people less than 50 years old. And in the elderly, falls are what are accounting for pretty much the large majority of patients admitted to the hospital over 65 with injuries are from falls.
And if something like that were to happen here, I say it all the time, we have, and it was just, you know, given an award, we have one of the best facilities that if you're involved in a trauma, you could be at. Doctor, they're giving me a wrap, so I'm going to say thank you to you.
Thank you. We appreciate
the magic of TV.
Right.
All right, we'll be back after this.